Can you give a quick intro about yourself, firstly?
Yeah, for sure. So, hi everyone. My name is Noreen Sajwani. I am the head of consulting at Impatient Health. I help our teams solve some of the biggest challenges in pharma, not just for today, but for tomorrow as well.
Cool. And can you tell us a little bit more about the inpatient health innovation process?
Our innovation process is really rooted in a couple of things. So, we look at futures thinking, speculative design, design thinking, and really the idea here is to think about what possible futures of the healthcare industry, specifically pharma, are within a specific scope. And then we really try to use that idea of what the possible futures are to create what we call a preferred future. So it's really co-creating and co-designing with our clients very practical, tangible steps about how you bring that to life. I think the easiest way that I can think about it is manifesting our vision for the future and then actually acting on it as well, which is really exciting.
And how does this innovation process help people currently working in industry?
It's a really good question. So, sometimes people think that because we're thinking of futures thinking, we're not necessarily going to do something that's impactful for today. But actually, there's two or three ways that this is actually really impactful for our clients when they're looking at how to create their business plans or how to do some strategic decision making. So, one example of that is, when clients come to us and they say, well, we want to see the effect of XYZ advancement in technology or through policy guidelines, maybe what payers are thinking about reimbursement or access issue. It really helps us see what are the ways that they can make business decisions in the future and make those forward looking, forward focused. And then another way is that it actually helps us think about what exactly are the future strategies and the products that we want to be adapting so that they're meeting the needs of our future clients and our future patients as they evolve as well. So that's, anticipating those future trends and then also using that very practically today to make business decisions is a large part of how we can apply speculative design and innovation process thinking.
Awesome. And do you actually have a specific example that you can share with us where this has been put into practice?
Yeah, for sure. So I think one of the ways that we've done this around patient engagement is with a client that came to us that said, in the future, we know that patient engagement is something that we need to be much more proactive about across the end-to-end value chain, but we just don't know how to get that process started. So one of the things that we did with them was we actually said, rather than trying to solve for patients, why don't we go out and ask patients what they want. So in helping prepare this pharma client for their product launch, we've actually helped set up a council of patients that are currently experiencing the particular disease area. And that not only helps us think outside of a product level, more onto a disease focus of what patients are going to be expecting and what their current experiences are. But it also allowed us to actually co-create and co-design that future for those patients. So they feel like they're actually able to feed into the product as it continues to develop and be launched in the next couple of years.
Amazing. Thank you so much, Noreen. And to everyone, we'll continue this conversation at Pharmageddon in Barcelona.